today with me is Dr. Roger Waltzman, our Chief Medical Officer. And Roger just got back from ASCO in Chicago, and I wanted to ask just a couple questions. First off, Roger, how did the presentation, your poster presentation go, and what do you think the key takeaways were?
Thanks, Jeff. I think our poster presentation went exceptionally well. Decoy20, our asset, was demonstrated to stimulate both innate and adaptive sides of the immune system with a myriad of cytokines and chemokines being upregulated from patients' baseline. This is exactly what we wanted to demonstrate from the preclinical research that was done. And this is really unprecedented because most strategies in immunotherapy look at a single pathway or a single cell type in order to try to stimulate the immune system, whereas we are looking across both major sides of the immune system, innate and adaptive, to try to stimulate it in a really robust way. We also showed very good safety data. The single dose of Decoy20 that was administered in these two cohorts was tolerated quite well. We did not see cytokine release syndrome. We did not see other adverse events that would be major barriers to being able to dose on a weekly schedule. So I think our presentation could not have gone better for where we are.
Great. In looking at other presentations or other posters, was there anything that caught your eye in relation to what we're doing at Indaptus?
Yes, there was one. Eikon Therapeutics has a product called EIK1001, which is a toll-like receptor 7/8 agonist. And they've shown monotherapy data in the past, but at this presentation, they were focused on a combination with pembrolizumab. And what's exciting about their data is that if this TLR7/8 agonist is adding to pembrolizumab, which it appears to be doing in settings where either a checkpoint inhibitor had not worked or ceased working, or in a setting where it wouldn't expect it to work at all, then that's an excellent proof of principle that even using one or two toll-like receptors can help stimulate the immune system in a way that augments the ability of a checkpoint inhibitor to work where otherwise it might not. And our strategy is to use not just one or two TLRs, but several TLRs in the same agonist package, if you will, that is Decoy20, along with NOD and STING agonists. So a myriad of ways in which we are stimulating the immune system. And because we have demonstrated some excellent safety data to date, it also gives me optimism that we would be able to combine this product with an agent like a checkpoint inhibitor or other immunotherapeutics that could benefit from augmenting the immune system even more.
Well, and it's exciting from the point of Dr. Perlmutter and Dr. Baines, who are working on development, are the ones who brought us Keytruda and developed a lot of the checkpoint therapy out there. Were there any other kind of key highlights you thought from ASCO?
I was pleased to see some evidence of early-stage efficacy in CARs for solid tumors. To date, chimeric antigen receptor therapy has been extremely successful in patients with relapsed leukemia or lymphoma, but it has been much more difficult to get CARs to work in solid tumors. And there were a couple of presentations demonstrating early-phase data of some efficacy in settings where you would not expect much activity. And although there is cytokine release syndrome, not surprisingly, associated with those treatments, I was pleased to see that evidence of efficacy for one of the first times in solid tumors, and hopeful that if Decoy20 continues to show tolerability and we can demonstrate that asset as an important immune stimulator, then it may have the potential to be combined with a CAR therapy in a solid tumor or another immunotherapeutic as well. So that was exciting to see another opportunity where Decoy20 might be able to enhance efficacy of a different immunotherapeutic strategy.
Well, great. Well, welcome back to New York, and thanks for the update.
Sure, thanks for the opportunity.